that you strengthen what we call the vital force in homeopathy, or in Chinese medicine, they call it qi or prana in Ayurvedic medicine, then the more that you strengthen that, the more that it becomes stronger. And this is what we want to do. We want to empower the body. We want to empower the body to heal itself. And I think it's absolutely crucial that we learn how to do that with some very common remedies. So today, we're going to be doing some of the top remedies for period pain. Now, this is not every single remedy that you could use for period pain, but these are some of the top remedies that you should definitely know about. Okay, and when we go through this presentation, you'll identify with some of those remedies. So let's go on to period pain. So the first thing I want to discuss is period pain. What is period pain? Well, period pain, or dysmenorrhea, painful periods is the medical term, is common. It's very common. I mean, I see it all the time in practice with women, and it's a normal part of your menstrual cycle. And most women will get it at some point of their lives. It can start from puberty, and we'll talk a few remedies that people have never been well since puberty in their first period. But it can start at any time, and it's normally felt as muscle cramps, often in the abdomen, in the tummy area, which can spread to the back or spread to the thighs. And again, we'll cover some remedies which will differentiate between where the pain goes. And it can also vary with each period as well. So some periods may cause little or no discomfort, and others may be more painful. And sometimes the pain can be intense spasms, while other times it can just be dull but more constant. And sometimes you get pelvic pain even when you don't have your period. But today we're just going to really deal with acute, okay, for acute period pain that you can take acutely. And if you do have more chronic and it's been long lasting for many years, and the remedies, you take them and you palliate, but it still comes back, month after month, then you may need to go see a qualified practitioner to get to the cause of the problem of what's going on. So the period pain happens when the muscular wall of the womb tightens, or the uterus tightens or contracts. And mild contractions occur in the womb, but they're usually so mild that most women can't feel them. But during the period, the wall of the womb starts to contract more vigorously to help the womb lining shed as part of your period. So this is an opportunity of the body to let go every month, is to let go and almost like reset the system every month. And when the wall of the womb contracts, it compresses the blood vessel lining your womb. And this temporarily cuts off the blood supply and oxygen supply to your womb. And without oxygen, the tissues in the womb release chemicals that often trigger pain. Okay, so this is, like I said, it's part of that process. And while your body is releasing these pain triggering chemicals, it's also producing other chemicals, such as prostaglandins. And these encourage the womb to contract more, the further increasing the level of pain. And it's not known why some women have more period pain than others. It may be that some women have more of a buildup of these prostaglandins, which means they experience stronger contractions. Okay, so every person's different. Every woman is different around it. And again, we know from homeopathy, it's very individual. Now, according to the NHS website, period pain can also be caused by medical conditions, which we're not covering today because this is more chronic problems. But it can be an underlying medical condition which tends to affect older women or women between the age of 30 to 45. And these can be endometriosis, it can be fibroids, pelvic inflammatory disease as well. And also adding, I'm not hoping to pronounce this right, the adenomyosis. Okay, so that's where normally the tissue lines the womb starts to grow within the muscular womb wall and makes your period particularly painful. But we're not going to be dealing with chronic conditions today. But again, period pain can be associated with some of these more chronic problems. So again, I would advise all of you to seek treatment from a qualified practitioner, which will be able to get to the cause of the problem. So let's get into the remedies. So the first remedy I want to discuss is Belladonna. Now, again, we're going to do this in alphabetical order. This is not the order of importance at all. But with Belladonna, it's menstrual cramps with the flow and a bearing down sensation. There's a bearing down sensation feeling in the uterine area. And often with Belladonna, as you know from doing these previous sessions, often it can be very fast, very intense and sudden pains, which are the keynotes throbbing pains with Belladonna, or they can have sharp and cutting pains. but they can have a profuse, bright red flow of bleeding. And sometimes you have this strange, rare, and peculiar sensation as though it feels very hot, that the blood feels hot. And it's also sensational, like with belladonna, all the blood rushes to a certain area and then starts to throb. And this is what you get with belladonna. It feels like all the blood rushing to one area and is the hot, congested, throbbing pain. Now with belladonna, the people are very sensitive to pain, want to be wrapped up, sensitive to drafts. Oh, shut that door. Or, you know, it's like the sensitive, very, very sensitive. But with belladonna, the pains, they come very suddenly and very intensely, but they'll go as quickly. Okay, so they go as quickly. And they're better for standing or sitting upright. They have to be sort of semi-erect in the bed if they're in bed. And also better for bending backwards. The pain may be better for bending backwards. But the worse lying down, like lying flat, worse being heated, worse for touch, and worse in the afternoons around 3 p.m. or around 9 p.m., sort of early evening, okay? So very, very sensitive. But the thing about this, the throbbing pains, as we talked about, the sensation of heat, the sudden intense pains, but then they go just as quickly, okay? So really, really important remedy to know, belladonna, belladonna. And again, you can see, well, these remedies have such huge uses. I mean, we've mentioned belladonna virtually every week on these live sessions. Very, very, very important remedy. Next remedy is Colafineum, blue cohosh. So this is for like severe labor-like pains during the period. It feels like they're going into labor. And periods can be irregular, so they come and they go. It's like sometimes that the whole pattern can change month to month. It could be, you know, they're late by 3 days or then early next month by 4 days. And they've often kind of had problems since puberty, since the periods first began. And here with Colafineum, they have a drawing-like pain in the thigh, as if the muscles are being pulled, like feel like they're being pulled up. Or they can have shooting, cramping-like pains with nausea, feel sick and vomiting. And often before the flow actually starts, they can have a pain in the lower lumbar region, okay? Sometimes they feel like the back can be breaking. And the thing with Colafineum is that they feel very tired and very heavy. They feel like the limbs feel heavy, the body feels heavy. And that's very much like gelsemium, the gelsemium. Even the eyelids can feel heavy, but they feel very tired. And again, one of the keynotes of Colafineum is you can have period pain, but at the same time have pain in the small joints sometimes, like the fingers or the toes, which is builds up before the period, but once the flow starts, the pain disappears. So remember, when we do our clams, I've talked about before, you're looking at location, looking at etiology, when it starts, you look at M for modalities, what makes it better or worse, you're looking for S for sensation, you know, what's the sensation like of the pain? But then you've got C, which is concomitant. What also comes along with the period? So this is where you would fill this in. They can have spotting and bleeding between the periods, and they're chilly, very chilly, worse open air, worse for coffee, worse for motion. Worse for coffee, worse for movement, better for warmth, okay? They feel better for warmth. They want to be wrapped up. So that's Colafineum, great remedy, blue cohosh. These are all, remember, all homeopathic potencies. Next remedy, chamomilla. So again, labor-like pains with chamomilla, but this time with chamomilla, they have brown blood, like a dark brown blood with clots. Keynote for belladonna, very angry, very irritable, leave me alone. They're so oversensitive to pain, they don't know what to do with themselves. They're in so much pain. And you know, the capricious, they'll ask for this. No, I don't want that. Can I have some cold water? No, I don't want that. It's in the wrong mug. It's like they don't know what they want. And they can be scolding. They become quite vicious when they're speaking with you. And the periods are very strong with cutting pains. Again, may extend up and down the thighs. So again, looking at these keynotes, pain can be up and down the thighs, but it's a cutting pain. Worse anger, worse at night, and again, worse from coffee. Another remedy that's worse from coffee. So when you're looking at this, it could be down to, 3 or 4 remedies. And you look at the remedies that have these modalities. Better for cold application, so that they feel better with something cold, maybe on their abdomen. And they're better for moving around vigorously. So they may want to go out for a walk, and that eases the pain. And again, you look at some remedies, they're worse for movement. This is how you differentiate between the remedies. But what will get you in with chamomilla is that often that mental and emotional state as well. This very angry, very irritable, very oversensitive to pain. Just like you would see that in a child who was teething, very angry, very irritable, don't know what they want. So again, this would tie you in to chamomilla and indicate you to that. Great, great, great remedy. Next remedy is Simicifuga. So Simicifuga, this has severe pain that gets worse as the flow increases. So some remedies have pain better for the flow. They build up and then it's bad pain and it's better once the flow starts. Simicifuga has severe pain that gets worse as the flow increases. And they have a cramping, shooting pain like electric shocks. And can have backache and muscle spasms in the back during the period. And one of the keynotes from Simicifuga, they have a sharp pain across from hip to hip. Hip to hip, one of the keynotes of Simicifuga, or pains that go hip to hip or go into the thighs and then shoot upwards. Shoot upwards. Now, when Simicifuga for this remedy, often it's for women who they get very negative, very gloomy when they're having their period. And they look at everything that's wrong with their life, this get so negative, and depression. And it all comes around this time. But once the period is finished, then the mood lifts and they're fine again until the next time. And again, with Simicifuga, the periods can be irregular. They can be late, they can be early, they can miss a month. So Simicifuga is a great remedy for the whole hormonal system. But again, another remedy that you definitely need to know. But again, look at the modalities, see, you can differentiate between the other remedies. Next remedy, Cholestynthis. So again, they have violent, cutting, griping pains, but intense griping pains. So much that the person goes into a ball, draws the knees up to the chest, which relieves the pain. It relieves the pain. Very angry like chamomilla, irritable with the pains that can come on from suppressed anger or emotions. So sometimes I've seen this in cases where, with the time of the period, any emotions that have been suppressed or kept in during the month will all come out at the time of the period. Why? It's a time of release. It's a time of letting go. And this is the opportunity every month, as I said, to reset, to let things go, to get rid of the old, ready for the bringing in the new. So the pains can be sudden and violent and may cause a person to scream out or cry out. A lot of pain with cholestynthis. And as I said, they can roll up in a ball and they can even vomit with the pain. Very restless. They can't find any relief anywhere. They'll be going to sit in the settee and then they'll get on the floor and then they'll go into the bed. But they're better for warmth and better lying on the abdomen. Why? Because they're better for pressure. So the pain is a lot better for pressure with cholestynthis and is ameliorated by bending up double. It's the pressure. They're worse from taking cold, they're worse from emotions, and they're worse lying on the painless side. So wherever the pain is, they want to lie in it because it's better for pressure. They lie, say, they're better for lying on the abdomen, and they're better when they lie on their back and they're not lying on the painful side, then the pains will really become severe and they've got to back and put the pressure back on again. And generally, this is a left-sided remedy. So sometimes you see this again during the period. They can have left-sided pain, right-sided pain, like ovarian pain. They'll get a whole set of different pains. But with cholestynthis, remember, it's the mental, emotional, again, the anger, the restlessness, the irritability. You think of chamomilla. But with cholestynthis, they need that pressure. It's better for pressure. And often they'll come up, like I said, into a ball. Great remedy, Cholestynthis. It's great for any form of colic or anything like that. Next remedy, Foss. Great remedy. I'm saying this about all the remedies, but Foss, what a wonderful remedy. Probably the most common remedy used in menstrual pain, in painful periods. And this is severe menstrual cramping with radiating pains. So the pains, again, can be like Belladonna, sudden, the burning, shooting-like pains, or boring pain with a sensation of constriction. And the pain often before the flow starts and is often worse at night. And you can have a lot of anxiety with these pains, and they feel exhausted, great prostration. They can even sweat with the pains, but they feel better for rubbing, but better for warmth. This is the keynote. Better for warmth. So you can see the picture here of the lady with a hot water bottle. They're better for warmth. They're also better for hard pressure, like Cholestynthis, and doubling up. But the difference with that and Cholestynthis is their mental and emotional state. I said incredibly angry, incredibly irritable with Cholestynthis. Foss is probably more anxious than anything. They're worse for cold air, worse for touch, worse for any form of exertion. It can bring on the cramps, and worse at night. And often you'll find, again, this is a right-sided remedy. But Cholestynthis was the left side. This is right-sided, but they are better for rest with a hot water bottle, often in bed. And some homeopaths actually put the Foss into warm water for the person to sip and to drink, which seems to help the remedy work better. I don't know. I just think they're better for the warmth to drink. But it's a great remedy, one of the most commonly remedies for, it's almost like the homeopathic painkiller, Foss. It's such a great remedy for any sort of nerve pain or pain, especially menstrual cramps or cramping. Great remedy to know, Foss. Next remedy, Pulsatilla. So with Pulsatilla, here the periods can be erratic and they can change from month to month. And this is the keynote of Pulsatilla, is changeability. If you not look at Pulsatilla as a plant, it's a flower. It's called the wind flower. It moves in the wind, very changeable. And the menstrual flow can be changeable. So it can be more during the day, on walking about. But another keynote for Pulsatilla is that painful periods ever since puberty. The periods, the cycle has never, ever been regular, okay, or painless. It's often been painful. And with the keynotes of Pulsatilla, as we know, they weep easily before the period, crave affection, sympathy, they want to be looked after, and you feel like you want to look after them. What can I do for you? How can I make it all right for you? Whereas the opposite to Camomilla, it's like, well, you want to shut the door, you know? It's like, let them suffer themselves because they're so horrible to you and shouting at you and scolding you. Well, Pulsatilla is very, very much more like they want the sympathy. They feel very forsaken. And they'll say, why did you leave me? Why did you go out for half an hour to the shops? Well, I went out to go and get you some stuff. Oh, I felt so alone. It's very forsaken, Pulsatilla. They have intense bearing down pains in the abdomen, worse lying, and chilliness. They feel very chilly with the pain, very cold. They can't get warm, and they go very pale. There's a lot of paleness in the face when they've got the pain. And they can often have diarrhea. They'll complain of diarrhea with the period. The worst for stuffy rooms. They don't like anything stuffy. They want movement of air. They'll ask for the window to be open or feel better for open air. And they're better to being consoled and being looked after or being hugged or being close to them. And again, the very famous keynote of Pulsatilla is they'll be thirstless during the period or during when they've got the pain. They don't want any pain. Anything to drink. Okay, Sepia. So Sepia, never been well since hormonal changes. Now this can be never been well since puberty, never been well since childbirth, never been since weaning, never been well since the contraceptive pill. Big remedy for this, anything involving hormonal changes. And this is where they have a painful period when the flow is scanty and can become too early, but again, can have irregular periods. And often with Sepia, they have bloating before the period with very low energy. They feel exhausted. One of the keynotes for Sepia, they'll crave chocolate. They crave chocolate. Again, a very common symptom. They crave chocolate. But the keynotes with sepia is they have this dragging down sensation in the abdomen. It's like a bearing down sensation where they feel everything would escape through the vagina. They feel everything would escape out. And sometimes you say that, I need to feel like I need to cross my legs. It feels like everything's going to come out. The sensation is so strong. Or they can have violent stitching pain upwards into the vagina. Very sharp pains. Very irritable, very sensitive, and they have a desire to be left alone. Aversion to their loved ones. They don't want to be around the family, they just want to be alone. Again, opposite to Pulsatilla. They can be worse from cold air, worse in the morning, worse in the evening, worse for standing. Anything where, because with sepia, everything's very congested. So they're worse for like standing, or they need to be moving. So they're better for moving. Often better for being busy or exerting themselves. For example, like, exercise, they may feel better at this time. But they need movement. It gets rid of this congestion within the whole system. Better for pressure with the pain, better warmth of the bed. Okay, so they feel better from the warmth of the bed. That's sepia. Again, another huge, huge remedy for all sorts of reasons. And finally, this remedy called viburnum, better known as its herbal form is cramp bark. So before menstruation, before the period, there's cramps and pain in the back, which extend to the pelvic area and down the thighs. Often can have a headache, feel sick, and feel uneasy with themselves. And they have these colicky pains, really common, was come on suddenly, just before the period, and can last for 10 or 12 hours, okay? And they often, again, they feel like their back is going to break with the pain. And often can have pain in the ovary areas, either left side, right side. And during the period, there's a constant urge to urinate. They need to feel like they need to empty the bladder and feel very nauseous, feel sick when the flow appears. And they'll pass large quantities of clear, light urine. And they have, again, the same pain during the period where it goes into the pain through the uterus, the lower abdomen, and again, down the thighs, as we mentioned before. Worse for movement, again, opposite to sepia, worse for movement. Worse for a sudden jar, which again, Belladonna can have because it's worse for jarring. Worse nighttime, worse being in a closed room. And again, worse before period. Better for pressure, better for rest, better for open air. Cramp bark. So you can get this herbally, or you can use it homeopathically. So I think that was 9 remedies we went through there. Again, not in any particular order. Well, it wasn't particular order. It was alphabetical order, but not order of importance. Again, you have got to match the right remedy with the symptoms that are being presented with you. There's not one homeopathic remedy for painful periods. There can be many, many, many different remedies according to the characteristic symptoms of what the person is presenting. And if you're prescribing as a home prescriber, you're trying to match those keynotes, those individual symptoms to what the person is saying. Now, if it's yourself, it's the same thing. And I say to everybody, I'm going to repeat this again. I think I'm going to do a video on this, on clams. Write down on a piece of paper, CLAMS, and fill it in. I would start with location. So location, where, period pain, where's the pain? They could say, back goes into the thighs. Etiology, since the flow starts. Modality, what makes it better and worse? Worse for rest, better for moving around, better for heat, whatever it is. Sensation, cutting, shooting, burning, cramping. And if you're trying to prescribe for somebody else, a member of your family, if they say, well, it's just like a period pain, isn't it? We'll say, well, how would you describe that pain? And you can give examples, like, is it burning? Is it hot? Is it cramp? Or if you had to inflict the pain onto me, what would you do to me? And they could say, oh, yeah, I would have like an electric shock that went down your thighs. So you need to get those characteristic symptoms. Then you can look at the remedies and think which one matches the best. You may be down to 2 or 3 that look really good. Choose one of them. Give it as a 30C potency. I say to everybody on this home prescriber sessions, just use 30C, what you get in the remedy kits. You can buy them over the counter at health food stores. You can buy them at homeopathic pharmacies. They're in the kits. Give it 30 and give it every hour for 4 doses and then stop if it's improved. If it's very severe, you can give it every 20 minutes according to the intensity of the symptoms. So that's just a general rule of how to prescribe it. But please use these remedies. They can be so amazing with people, especially when they're in pain. There's an old myth with homeopathy that says it takes a long time for homeopathy to work. That is utterly false. Homeopathy can work like that instantaneously in acute situations and in pain. Chronic cases, it's something different. It's taking time to get into that state. And I always say, for every year you've had it, it takes a month to clear, homeopathically, in a chronic case. In acute case, it should work instantaneously in acute pain. As you described Foss, for example, in toothache, you can use it in toothache. Straight away, it will work. It will ease the pain. And then it may come back again, so you repeat the remedy again, because you're following the vital force. What does the vital force show me? It needs to tell me I need to repeat it.